I'm Haley Leeper. I'm a small animal medical oncologist here at the Carlson College of Veterinary Medicine.
And I'm Katie Curran. I am also a medical oncologist here at the Carlson College of Vet Med. Our mission is really to provide options for people and their beloved pets. So often with the diagnosis of cancer, that can be a really incredibly emotional and challenging time when often we all feel pretty powerless. And so our mission is to help people see that there might be options, especially related to their pet feeling better, hopefully living longer, feeling good, and certainly relieving any pain. And then a kind of subset of that we also feel strongly about is research and always trying to grow kind of our current understanding of how we might be able to treat this terrible disease better and better over the years. We both do a lot of research related to clinical trials, and I would say the biggest thing that I would want people to know in the public and for alumni and supporters of OSU is that we see the option of clinical trials as just another option in the hopefully multiple good options when an individual pet is diagnosed with cancer.
So clinical trial research in dogs and cats has an added benefit of comparative medicine, that a lot of this stuff will translate over into human oncology patients, either in the short future or down the road.
So our two clinical trials right now are both treating dogs with lymphoma. One of them is evaluating pets on kind of our mainstay chemotherapy protocol, but evaluating their microbiome over time, so that natural flora and fauna that they have in and on them. The second chemotherapy clinical trial that we're looking at is trying to see if a new combination of chemotherapeutics is better than the current combination of drugs that we've been using for about the last 20 years, with the addition of a new agent that's recently come into the veterinary market.
So Gunther has been diagnosed with multicentric lymphoma, which is unfortunately one of the more common forms of cancer that we see in dogs. He is being treated with a multi-agent protocol that is fairly standard for how I would like to say gold standard, but we're hoping to change that with the trial that he's enrolled in. And currently he's about a quarter of the way through his protocol, but doing great. All of his lymph nodes have returned to normal size, which would indicate that he's in a clinical remission, which is fabulous news. So Gunther's enrolled in the Teashop clinical trial, and it's just an acronym for all of the drugs within this multi-agent protocol. Our typical standard of care protocol is the CHOP protocol that uses 3 different chemotherapy agents, and what this clinical trial is doing is actually adding a 4th additional one, Tenovia, which adds the T to it. And what this clinical trial is looking at is not only the side effect profile of adding this new drug into a multi-agent one, but also if the clinical benefit is better than the standard CHOP therapy alone. In addition, this clinical trial in particular is being available at several sites throughout the country. And so we find that it's very helpful to be a collaborator with research that's going on not only at OSU, but at other veterinary sites. So anytime that we have the ability to try something new and have a different outcome, hopefully for the better, it's really exciting, not only as a veterinarian trying to do the best we can for our patients, but also on the research side of potential further options down the road of what we could add in to these protocols to make a bigger benefit, not only in dogs, but potentially in people.
Piper is one of our patients that's in the microbiome study, and she has lymphoma, as we talked about, and so we're treating her with her next dose of chemotherapy today. So Piper is a little over halfway through the chemotherapy protocol, which is a nice stretch. She's been tolerating the medication quite well. Her cancer is currently in remission, which is wonderful. That's absolutely our goal. Actually, at her next appointment in a couple of weeks, what we'll do for that study is we'll take some swabs, but we basically swab around her nose, her mouth, and then right around her bum. And then we also take a little bit of a blood sample, just a couple of milliliters, and we take all of that information and send it off to our colleagues at the lab, and then we evaluate the microbiome that way. This is definitely kind of, I'd consider, foundational type of research. So we're really trying to see, are there any themes that we pick up when we assess these patients over time? Are there factors that we can look for in the microbiome that could be helpful to us? Because that could really inform treatments down the road. That could inform additional research, kind of narrowed in based on what we find, that could help change even therapy for these patients. Our hope is kind of what's coming on the cusp of microbiome research is actually using the microbiome to narrow in on what are some of the strands of bacteria that can really be beneficial to patients. And so if we could identify patients that have those beneficial strands, and maybe they're responding better to their chemotherapy or they're having a much longer survival as an example, if that's something that we can kind of harvest from patients and then transplant and give to patients that maybe lack those types of beneficial microbiome elements, that would really be revolutionary and could be a treatment that could have very few side effects, could be very well tolerated, and at least from some of the research that's coming out of early work with people and then a lot of other models and also just other disease processes, that could be really exciting.
A lot of animals live in the same environment as you and I do. They eat a lot of the same foods, they're exposed to a lot of the same kind of environmental toxins, and their cancers are naturally arising. And what we see is that they all tend to present very similarly between dogs and people, and how they progress as well. So there's a lot of kind of opportunity there to do research. So it's very exciting to not only be able to help the pet community, but potentially have that ability to help people as well.